All right. Good morning to those of you that have joined. It is 11 o'clock, so we're going to go ahead and kick off and get started so we don't take up too much of your time on this Friday. We appreciate you being here on a Friday over the summer. We know that summers are always very busy, and so we appreciate you taking the time to be here. Today, we're going to start our second Medicaid mini webinar. This one will be Meet Your Payors. Today, we'll go over the managed care plans, the benefits, the differences, and kind of just the whole managed care program as a whole. So I am Jessica Emmerich. I'm the Dental Medicaid Facilitator. I'm with the Missouri Coalition for Oral Health. The Missouri Coalition for Oral Health has partnered with the Missouri Dental Association and MoHealthNet to provide enrollment, credentialing, and billing support for dental Medicaid providers. The Coalition is a 501c3 advocacy organization, and we're focused on policy and systems change to increase access to oral health services for all Missourians. You can learn more about the Coalition and other upcoming events by visiting our website, Facebook page, Twitter, and LinkedIn. The goal of this webinar is to meet you where you are, whether you're considering Medicaid or already participating in Medicaid, and then we're here to support you through the process. Our session is being recorded today and will be available on our website. The follow-up emails will go out Tuesday, which will provide the recording, the slides, and any questions and answers we had during the session. You are muted because we're in webinar format, but you can submit your questions in the chat or the Q&A box. Both of those options are at the bottom of your screen. We will answer those questions at the end of the presentation, and we'll allow plenty of time at the end for any questions and answers, while also being respectful of your time. So we'll go ahead and jump into this. Okay, so as I said, today's session is called Meet Your Payors. We'll be talking about the managed care plans in Missouri Medicaid. The first thing we need to talk about before we talk about the plans is the MoHealthNet coverage. So once an individual is approved for MoHealthNet coverage, they will either receive their services through MoHealthNet, which is considered fee-for-service, straight Medicaid, or one of the managed care plans. They're divided into two groups. The fee-for-service MoHealthNet participants are adults with disabilities, seniors over the age of 65, blind, visually impaired, or women with breast or cervical cancer. Everyone else, newborns, children, pregnant women, adults, families, they receive their services through a managed care plan. We'll kind of dive into what's covered for which participants. In the fourth session, Decoding the Codes, we'll go through the actual coverage for the participants. But one thing to keep in mind is that it's all Medicaid. So all the managed care plans are considered Medicaid. The menu of services are going to be the same, whether the person is in MoHealthNet or managed care. For example, participants with disabilities. Children are usually assigned to a managed care plan, but if the child has a disability, they can opt out and be seen through, receive their services through MoHealthNet. The coverage is the same, they receive the same services. The only difference is the payer of those services. So MoHealthNet has 3 different managed care plans. Those managed care plans are, again, are responsible for administering the benefits on behalf of MoHealthNet. The first is Healthy Blue. They use DentaQuest as their dental contractor. Then we have Home State Health, who uses Involve for dental services, and United Healthcare, who is responsible for their own dental services. There was also a new Show Me Healthy Kids option. This is under Home State. So if you enroll with Home State Health, you are also enrolled with Show Me Healthy Kids. It is not a separate application. And the Show Me Healthy Kids, that is a plan specifically for state custody children. We found, sorry, not we, MoHealthNet found that it often disrupted care when children were going from foster home to a different home or placed in different places, and they would request to change the managed care plan. And it often disrupted the care. So in an effort for continuous care, they created the Show Me Healthy Kids program so that all those state custody kids are in one plan. They have the same providers and can get better continued care. The Show Me Healthy Kids program is also, they provide a few extra behavioral health services to those children because of their situation and the services that they need. Another thing I want to point out real quick about the managed care plans as a whole is that the managed care plans are responsible for providing the same services as MoHealthNet. So if it's covered by MoHealthNet, it's covered by the managed care plan. You may have recently seen the rate increase for MoHealthNet. The managed care plans will also follow suit. The only difference is the way they administer those. So for example, if MoHealthNet does not require a prior authorization for an extraction, the managed care plans may. So they are their own separate entities. And so you need to connect with them also to make sure you understand which services require prior authorizations, documentation, etc. Another thing I'll point out about the managed care plans is that they are not umbrella plans. So I've had providers that have the concern that if I enroll with United Healthcare, I have to see any patient who comes in with a United Healthcare card, and that is not correct. So United Healthcare Medicaid is separate from United Healthcare PPO. You can enroll with just United Healthcare Medicaid and not be responsible for seeing those PPO plans as well. There are no umbrellas with the managed care plans. On that same note, if you are already enrolled with one of these, say you're enrolled with Healthy Blue PPO, you would still need to recredential with Healthy Blue Medicaid. They are separate companies, separate entities, and they each require their own credentialing. Okay, so we're going to walk through each managed care plan and just tell you a little bit about it. I think it's really helpful to know what you're looking for when the participant comes in. If they come in and say they have Healthy Blue Medicaid, how do you know? So here's an example of what their card will look like. All Medicaid participants should receive a card in the mail as long as their address is correct, of course, for their coverage. So this is what Healthy Blue DentaQuest for dental providers, what their cards will look like. They include a Medicaid ID number and a DCN. The member ID number and the DCN are going to be different numbers. The DCN is the MoHealthNet participant number. This is the one that you will need to use for your claims. It's an 8-digit number. This is the MoHealthNet ID number. On the back, they also list the phone number for if you have any questions about it, but I'm also going to give you direct contacts for the plans to make it easier for you to work with. But this DCN number is what you're looking for. So DentaQuest has 3 different places you can find their application. App Central, you can do your application there, in their provider portal or on their website. You'll get a copy of these slides, so you will have links. You'll be able to go to those sites directly. All the claims and prior authorizations for DentaQuest are submitted online through their portal. So you can do that directly on their website. They'll set you up with a portal. Once you have credentialed with them with the username and password, you'll be able to verify eligibility, submit claims, prior authorizations, all through their portal. You also do have the option to mail them. Here's that information here. And then if you use a clearinghouse, they're going ahead and providing their payer ID so that you can pay those through a clearinghouse as well. So they are very user-friendly. I've not had many complaints from providers about their portals. It seems to be very user-friendly and easy to navigate. So again, we're talking about managed care plans. So these are children, pregnant women, and adults who would be under one of these plans. DentaQuest has provided their office reference manual. Again, you will get a copy of this, so you can you can click the link and go right to that information to have the list of all the covered benefits. So I often get questions about the rates with the managed care plans. The managed care plans are required to pay at least what MoHealthNet does. So we just saw the rate increase for extractions. So the managed care plans will follow suit. That is the minimum they're allowed to pay for that service. If you are expecting higher rates, or if you need to see higher rates, or if you see one rate that just looks like it definitely needs to be a lot higher, you have the option to negotiate with the managed care plans. You can treat them as you would any other insurance. You will negotiate a contract with them during the credentialing period. So if there are extra services you need covered, or higher reimbursement, or different processes, ask them for it. I can't say that they will do everything, but I can say that they need providers in their network and that they want to work with you. And they want dental providers to be paid for the services they're providing. So just keep that in mind when you're starting with these managed care plans, that you do have the option to ask for more. Their only requirement is that they provide at least what MoHealthNet does. I do know that DentaQuest covers an additional crown code for pregnant women that isn't typically covered by MoHealthNet. So that's just a great example of, if you need an extra service, you can ask for it. Another thing DentaQuest usually asks is, even if a code is normally not covered, I have to think of a specific example. So I'm gonna go back to crowns for this. So adults, they receive crowns. They only have a couple of crown codes that are covered for adults. There's another one that you really need to use. You know it's gonna be denied. If you go ahead and submit the PA for that and get that denial, it's just documentation for you that you can then charge the patient for, because it's a non-covered service. So DentaQuest does not mind at all for you to go ahead and submit those prior authorizations to show the patient it's a non-covered service. Then you can do a payment agreement for that service. So again, I said I was going to give you direct contact information for the managed care plans. DentaQuest was very happy to provide 2 wonderful representatives to reach out to. They divide the state in half. If you may have worked with Tanisha, if you have worked with DentaQuest in the past, Tanisha used to be over the whole state of Missouri. Now they have divided it in half because we have seen an uptick in dental providers, which is wonderful. So Tanisha is going to be on the St. Louis side, and then Michelle is on the Kansas City side. So you can kind of see which county you're in. And then here is their contact information, which is so wonderful that they are willing to go ahead and provide you with that. If you have questions about their plans, about what's covered, about what needs additional documentation, or if you're already enrolled in Medicaid and you're having an issue, you're seeing denials and you weren't expecting them, you thought they should have been covered, these are great people to reach out to help you resolve those issues. They've also provided their supervisor's information down here. If you have any trouble reaching them, you can always reach out to Jennifer. And then here's some other just helpful information for DentaQuest to keep in mind. So great resources. Again, you'll get a copy of this, so you'll have it on your desktop. So next we have Home State Health, which uses Involved. You may have also heard them considered Centene. So here's an example of what their cards look like. You'll notice that the Show Me Healthy Kids, their cards are a little bit different just because they have the Show Me Healthy Kids. This is really great to have on here because that identifies them as that Show Me Healthy Kids population. So you know that this participant is always going to be Home State Health unless their situation changes. For the most part, they're going to be in the same plan. You don't have to worry about them hopping around between plans. So again, MoHealthNet ID number, DCN number, they're interchangeable. So while DentaQuest uses DCN number, Home State Health uses MoHealthNet ID number. Again, it's going to be an 8-digit number here. That's the one you're going to use for billing. Also, when you're billing, you need to make sure that the names match up. We need to go to search eligibility, make sure you have the name exactly as it is on the card. I know a lot of people who go by a shortened name or a nickname or even their middle name. To make sure you're verifying their eligibility and the claims properly, you need to make sure the names and the Medicaid ID numbers are matching. Okay, so here is their contact information. So provider relations at involvedhealth.com. Yes, it's a generic email, but I can tell you exactly who it goes to. That will go to Eric Rolls. He's been wonderful to work with, and he can help you with navigating Home State Health. He's the dental representative for the state of Missouri. If you have any questions or having trouble reaching him, please let me know, and I'm happy to help make that connection. Again, here is their website where you can find their resources. And then here is a link to their training information for their basic orientation training to kind of walk you through their portal, their processes, their provider manuals. Here's all your one-stop information for them. And then United Healthcare is our third plan, which they administer their own dental services. So it'll be directly through United Healthcare. So on their cards, you'll see they have a member ID number up here, and then they have a DCN number down here. So again, we want to make sure we're using the DCN or MoHealthNet ID number when billing. Okay, and it identifies that they're MoHealthNet under the group number. So here's an example of what their cards look like. For credentialing, this is the best email to submit questions to. They can help you navigate the credentialing process, answer questions about the credentialing application, and then answer questions about if you're checking the status of your application. So this is the best contact for them. They do have phone numbers and email addresses for their provider services. So I'm going to say provider relations. This is going to be for if you have questions before you're credentialing or after you've already credentialed. So if you're just having questions and say, what's the fee schedule? So again, that fee schedule is going to pretty much match MoHealthNet's, but they do have the option to pay more. So it never hurts to ask for the fee schedule to make sure you know exactly what you're agreeing to. Or if you're already enrolled with United Healthcare, you're new to it, you've submitted claims, you're seeing denials and you're not sure why. Again, that provider relations is the best email address to send it to. That usually goes to Rachel Bell, which again, I can help you get in contact with her if you have any trouble, but she again has been great to work with. Our contacts at the managed care plans are the same ones that MoHealthNet works with. So it really helps to have a direct person to know who you're talking to. That way, if you're seeing an issue and you've talked to these contacts at the plans, it's still not getting resolved, you can reach out to MoHealthNet. They're talking to the same people. So it really helps to expedite getting these issues resolved instead of, you know, all your chains of command not connecting and not talking to each other. So it really helps. We really want to help make this an easy process and a seamless transition. And then we want to make sure that you guys are getting paid for those services. Okay, and then I also want to show you MoHealthNet. So MoHealthNet, again, this is for your people with disabilities. This is for seniors, blind, visually impaired. So it's a smaller population, about 25% of Medicaid participants receive their services directly from MoHealthNet. Their cards are very simple. You're not going to have a lot of information, but this MoHealthNet ID number, that's the number you're going to use to verify eligibility and that you'll use on your claims. So it's really important to know the MoHealthNet policy and training information because managed care plans are going to follow MoHealthNet rules. So if there's a question to a managed care plan about I provided a service in this situation and it didn't pay, I think it should have. And the managed care plan says, well, I don't think so. So they're going to go back to MoHealthNet and look at MoHealthNet policy, and that's how they're going to determine if yes, that should have been paid or not. They'll look back at if MoHealthNet would have paid it, then the managed care plan will pay it as well. So MoHealthNet offers dental provider trainings they were doing them every 6 weeks or so. Now they're going to about 8 weeks over the summer. They may pick them up again in the fall, but I highly recommend that you attend those trainings. Lee Gerloff is the one who leads those, and she is a great resource. She will walk you through all of the MoHealthNet resources. She'll walk you through EmoMed and show you how to check eligibility, how to submit a claim, how to do secondary claims. So those webinars are interactive, so you are able to ask plenty of questions, and she can get a little more specific. So if you decide to enroll with Medicaid and once you get into it in the billing, if you have just a general question, like, hey, is this covered, or does this need prior authorization, or I'm just not sure how to go about implementing it into my office, I am happy to answer those questions, and I usually have most of that information. If you get enrolled and you start having issues with a specific ME code or certain patients that you're really seeing, if it's patient specific, please reach out to MoHealthNet or the managed care plans. I cannot handle the public health information, PHI information, because I'm outside of the state. So please go to them with those specific questions, but the general ones getting you started, I'm more than happy to help with that. But here's that contact information. Here's the phone number. Again, you can ask for Lee Gerloff. Emails can be sent to mohealthneteducation@dss.mo.gov. Again, they're going to be routed to Lee because she's the dental representative. Again, it's great to have one person to work with instead of several. And then I'm also including links to their MoHealthNet provider resources, training resources, etc. We could dive into that if we have time, but there are many, many, many resources. So that's always great. And again, that's going to be your source of truth. So another thing that has come up from providers is they get started and they go to verify eligibility, and say you use DentaQuest portal to verify a patient's eligibility. They have their card, looks like they have DentaQuest coverage. You check it in the portal and they say, nope, not active. It's really important to know how to navigate MoHealthNet and how to navigate their portal, because again, they're going to be your source of truth. So then you would go into the MoHealthNet portal, you would look them up there and say, oh, maybe they didn't meet their spend down. Maybe they changed managed care plans. Maybe they lost eligibility because they didn't respond to their application request. So those are situations we'll kind of dive into in the next ones coming up, but it's always important to know MoHealthNet policy and how to access their information along with the managed care plans. Even if you're a provider who typically only sees, if you're a pediatric dental provider, you only see children, you don't expect to deal with MoHealthNet at all. You still need to know their resources because again, like I said earlier, a child comes in with disabilities, they're going to receive their services through MoHealthNet. So they're all intertwined. It's great to know how they're all working together. Again, MoHealthNet is going to be your policy and your source of truth for most of the coverage. They also have provider communications. So this phone number, and then you can also email them through EmoMed, which again, Lee will show you how to do that. This is for information about a specific claim. So if you get a claim and you see the remittance advice and it was denied, and you don't really understand why, provider communications, they're the ones who can actually look at that claim with you and kind of walk through it and see why did it deny? What does need to change? And maybe it's just something simple where you can go back in and then they can give you instructions on how to get it corrected. So another great resource, this number, I believe it is an IVR. So that means it's an automated message where you're going to have to punch some numbers to get in. You will need to have your MPI number when you access that. Okay, so that is a very high level summary of the managed care plans. And again, we're going to dive into coverage and eligibility and what they're all covered for and how it all works together. Today, we were just kind of trying to hit a summary of the managed care plans. So I want to take time to answer any questions that you have. If you have any questions, please put them either in the Q&A or in the chat. Again, both those buttons are at the bottom of your screen, and we'll go through and we'll answer any questions you may have about the managed care plans. Okay, well, while you're thinking of any questions you may have, we can go ahead and we will look at some of those MoHealthNet resources that I had mentioned. So here is the link. I'm putting it over in the chat. So this takes you to the MoHealthNet dental provider page. So they changed their website around, probably around beginning of the year, so that now they have all the dental resources in one page, which is wonderful. It used to be scattered all over the place. So it's been great that they have all of your information in one place. It makes it much easier for you all to navigate. So again, I think we looked at this briefly last week, but I will just go over it again. Here you can find their dental provider manuals, the list of covered services, benefit tables. So this is a great resource to find all the information about it. If you want to know a little bit more about the managed care plans, they do have these little presentations out here. That's just a little bit more about their plans and what their portals look like. I don't get too involved with the actual billing or credentialing with the plans, just because they are their own insurance, they're their own companies, and they prefer to do that with the providers directly instead of through me. So again, but here's some great information about the plans. I do know that DentaQuest, I'm not sure about the other two, but I know that DentaQuest does what's called a dental home program. So I have had new providers who decide to sign up with Medicaid and then say, well, how do I go about letting participants know that I take their care? So one thing that DentaQuest does is that when they get new Medicaid participants in their plan, they send out a postcard that has a dental provider's name and address that is close to them. So, and they're assigned to that kind of dental home. And then the dental provider, they can access that through the portal to see which participants have been assigned to them as a dental home. And that's just letting providers know what new participants they have in their area that have that coverage. So that gives the provider the opportunity to reach out, or the participant an opportunity to reach out and set up an appointment. They are not locked into that. That participant can still go to any provider they choose. It's just giving that information that they do have a dental provider in their network. Okay, there was a question in the Q&A, says, where can I find out which procedures need prior authorizations for each of the plan, MoHealthNet and the third-party providers? Great question. Okay, so for MoHealthNet, again, we'll go in here. The best place to find that information is in the dental provider manual, and then in section 5. So section 5, this is our whole list of all the covered services. And this column here that says PA, this indicates if those services need a prior authorization or not. Again, it can be different than the managed care plan. So for example, these are orthodontics. So most of the time they do offer. Orthodontics is a whole nother topic, and I'm happy to talk to any orthodontic providers we have on here about how those processes work. So let me just find one. Okay, we're just going to use this one for an example. So this crown requires a prior authorization through MoHealthNet, but the managed care plans may not. So how do we know that information? So you can either reach out to one of the contacts that I can provide to the managed care plans and just ask them directly. Or if you go into the MoHealthNet page under the education and billing, I'm going to click on this first link, MoHealthNet education and billing. These are links to the managed care plans. And on these, you can usually find their office manuals. And then that would have that information listed there. So MoHealthNet tries to include links to that information. But again, I can provide direct contacts, so you can reach out to a specific person to find out that information. Again, they don't give me their provider manuals because they update them often. So they want to be able to give the new dental providers the most up-to-date information. So it's really helpful to reach out to them directly to get that information. So I hope that helps. And I have been told that the managed care plans don't require as many prior authorizations as MoHealthNet. I don't know if that's true, but it's something I have been told. So you can correct me if I'm wrong. But the great thing about the managed care plans versus MoHealthNet when it comes to prior authorizations for dental services, MoHealthNet dental services, you have to submit those prior authorizations by paper forms mailed to MoHealthNet. The managed care plans, they have the ability to do it through their portal. So you can upload all the information right there to their portal. They take care of it, a much quicker process. MoHealthNet does take a little bit longer just because we're at the mercy of the mail. Again, these presentations are really great because they are going to have a lot of resources for you. Again, that I don't have, but you can find in these presentations or through contacts that, like Healthy Blue is Tanisha or Michelle that we talked about. Home State Health is Eric, and then United Healthcare is Rachel Bell. What other questions or concerns? What are your thoughts about the managed care plans? Happy to have any discussions. Again, the great thing about these webinars is that if you're having the question, the odds are someone else is having that same question. So I really appreciate anyone willing to bring those questions to light so that we know more about what information we need to provide, what information we need to have readily available to the managed care plans, to the participants about the managed care plans. We can talk about, I hope you saw the email about the dental extraction and sedation rate increase. I have seen the question of if the managed care plans will follow that, and the answer is yes. So they have, I believe it's 30 days to implement that. Again, MoHealthNet is still waiting on CMS approval for that, so we're not actually seeing that reflected on claims yet. We expect to see it probably in September or October. At that time, MoHealthNet and the managed care plans will go back and recycle claims between July 1st and whatever the CMS date approval is. And they'll recycle claims and pay the difference to get up to those allowable rates. Let me know if you have any questions about that. If you've been enrolled with Medicaid before and you were enrolled during the 22 rate increase, you've seen this before. Okay, does eligibility change for patients on a day-to-day basis? Well, we need to check daily that a patient is active. Their eligibility should not change, but it is important that you verify eligibility on the data service because it can. For several years, a couple years, okay. Because of COVID, Medicaid participants were locked into their coverage. They were locked into their plan. They were locked into their coverage. Their coverage did not change for about 3 years. Recently, they have lifted that so that now they are reviewing participants' eligibility. As long as those participants are respondent to those eligibility requests, their eligibility should not change often. But it is important that you do verify it daily on the data service to make sure that you're covered. So the MoHealthNet portal and the managed care plan portals, they keep track. It records what your activity is on there. So they can verify that, yes, you verified that patient's eligibility. So then you know that you're going to be paid for that service. If for some reason you didn't verify eligibility and they had, say they have a spend down, which spend down is always a tricky topic. And I try not to bring it up because it's a difficult concept that we will talk about it, I promise. So spend down is like they have a premium. They have to pay a certain amount before their eligibility kicks in. If you haven't verified their eligibility, you don't know that, they haven't paid that, they are not eligible for those services to be covered until they have met that spend down. So we want to make sure that you get paid. So it's really helpful to just have you guys verify the eligibility on the data service. Again, the state and the managed care plans will have record that you verified eligibility on the data service. That's to make sure that you can get paid for those services. We do see it occasionally. I've seen it just a couple of times where they will retroactively change a participant's eligibility. Again, it does not happen often at all, but you doing your checks and balances to make sure you verify eligibility will make sure that you get paid for that patient. So I hope that helps. Okay, so going back to the prior authorization items we were talking about earlier, for endodontics, MoHealthNet doesn't require a prior authorization for endodontics, but apparently some of the managed care plans do. Okay, so yeah, I can, if you will follow up with me after the webinar, I'll go ahead and send you emails, direct emails for those people that we've talked about. Anyone can email me and I'm happy to share those. We just did not want to include them unrecorded, published webinar, but feel free to follow up with me afterwards and I can provide that information so that I can get you in contact with them and they can go over that. Again, that's another thing that it's important to talk to the plans and just talk to them about what you need to see from them. Is the prior authorization, is it causing issues? Is it delaying care? So talk to them and let them know, what do you need? What do you need from them? How can this work better? And let me know that information as well. I meet with Missouri Dental Association and MoHealthNet every other week where we just talk about what are we seeing providers? What can we do to continue to advocate for providers and make Medicaid a better process? So please reach out to me afterwards. If I don't hear from you by early next week, I will follow up with you with that information to make sure we get you the information you need. Of course. Yeah, I'll see if we can include that information in our recap email. That way everyone will have access to that, to those contacts. Again, it's great that the managed care plans are willing to work with us and give us those direct contacts. Like I said, it has been helpful to be able to work with one person consistently instead of being passed around. They know your history, they know who you are, they know what your situation is and the services you provide. So it's always easier to work with them to get any issues resolved and get any questions answered. Okay, we have exceeded our 30 minutes. And I want to be respectful of your time on this Friday. So we do have some extra time. If there's any other questions, I'm happy to stay on and answer those. Okay, if there's no other questions, then please feel free to follow up with me afterwards if you have any questions, concerns, anything you want to discuss. If you missed something in the first session and you want to follow up on something, I'm always happy to have a discussion, or give me a phone call, text, email, whatever is easy for you. I know you all are very busy. That is one thing I have learned about dental providers, is that they are very busy. So we want to make this easily accessible to you. So again, here's my contact information, email address, phone number. I do call or text, whatever is a better option for you. Our next session next week will be Credentialing 101, where we're going to walk through the MoHealthNet enrollment process and the credentialing processes for the managed care plans to see what that looks like, so you know what to expect. I'll give you some tips and tricks on how to navigate that so we can make sure that you are enrolled and credentialed as quickly as possible. And then where do you go from there? How do we get started? So after next week, we'll also talk about decoding the codes. That's where we're going to dive into participant eligibility codes and knowing which codes are covered for which patients, and how to make those determinations. And then the last session we will have Legal Lock with MoHealthNet on here as well. And we'll actually walk through some claims to give you an idea of what that claims process looks like. So making sure there's no other questions. All right. Well, we will go ahead and wrap it up today then. Thank you again for being here today. I appreciate your attendance, and just follow up with me if you have any questions or concerns. Always happy to help. And we hope that you can join us again next week. Thank you all.